Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it.
Hey everybody, Crystal Stokes here, and today we are going to learn all about WisCARES, which is a community veterinary clinic located in Madison, Wisconsin for families experiencing low income and or homelessness. And we have a whole team of people joining us today. I'm going to allow them to introduce themselves briefly. So let's start off with Ruth Ann.
Hello, my name is Ruth Ann Chun. I am a veterinarian and I'm the program director for WisCARES.
Jennifer Brooks. I'm the Director of Social Work and Outreach and a social worker at WisCARES.
Hi, I'm Kelly Schultz. I am one of the veterinarians at WisCARES, and I'm also the medical director.
Hi, I'm Hillary Cox, and I am one of the CVTs at WisCARES and also the practice manager.
Excellent. Well, thank you all for being with us today. I know we're really excited to talk about WisCARES today. So let's just cut right to the chase and tell everybody listening, what in the heck is WisCARES? Ruth Ann.
Yeah, so it's WisCARES. A lot of people call us WisCARES because it's kind of a funny way to spin the name, but we are the Wisconsin Companion Animal Resources, Education, and Social Services Program. And we are a program from the School of Veterinary Medicine, but we're completely in a separate building from the School of Vet Med. We got started because certainly as veterinarians, we all recognize there's a need in the community, especially folks that are experiencing homelessness or low income, this whole access to care veterinary medicine thing. But in 2013, I was serving as the director of the teaching hospital in the vet school. And we had a gentleman experiencing homelessness come hoping for medical care for his dog with an ear infection. Through a series of unfortunate events, he got turned away. Somebody else on campus helped him and his dog, and then they sent our dean at the time an email just saying, "Come on, you guys, what's going on?" Of course, the vet school has a fund to help folks like that, but it was a series of unfortunate events. And so the dean at the time, because I was the hospital director, just said, "Hey, what do you want to do about this?" And he gave me the opportunity to hire somebody to start building a program to do outreach medicine, veterinary medicine to folks that are experiencing homelessness to help take care of their animals. And very quickly in the fall of 2013, we got connected again through the dean by one of the professors at the School of Social Work who had a very strong interest in homeless youth with animals. And so very quickly, we became an interprofessional program. We started doing outreach just at the Salvation Army and the Tenant Resource Center here in Madison. And by becoming part of the Dane County Homeless Services Consortium, we developed a really strong network of referrals from all of the organizations that serve the homeless population. And grew very, very quickly from there. So from 2014 till today, in serving patients and clients, now we are in a rental property on the south side of Madison and with 2 veterinarians, 2 CBTs, 2 social workers, seeing patients Monday through Friday.
Wow. Can you take me back to when you first started? What did the first 6 months to a year look like? How did you really rubber meet the road, make it happen?
Yeah, that first 6 months to a year was a lot of going out, talking to local veterinarians, talking to care providers, getting to know what the need was, making connections. I will say that the first veterinarian that I hired was instrumental in doing all of that. He just was incredible. really just trying to plan and think what's needed, what's necessary. Talking to pharma, we have so much support from pharmaceutical industry, from the pet food industry, and then how do we make this work? So it was a lot of meetings, a lot of talking, a lot of trying to figure it out, and then finally we just said, okay, we've been talking for 6 months. Now we need to start just going and setting up a walk-in clinic, which is how we started. And so then 6 months or so later, we ended up in a donated property that we could see patients in, and we could have, at that point, like a pet resource center. And we had, by that point, a social worker working for us as well. And we were seeing enough patients and working with the vet school, having students come out to work Tuesdays and Saturdays on a volunteer basis. And we were just too busy. We really needed to open up a clinic that was Monday through Friday, where we could actually also do surgery, do some exchange of money, and potentially have overnight patients as well. And that's when we got a rental property that was in 2018. And that's where we continue to be today.
Interesting. What would you say were some of the primary obstacles that you have faced in the almost decade plus that you've been around?
I'll say from my perspective, the biggest obstacle is money, funding. How do we make sure we keep this funded? Because we do charge for our services, and we kind of have 3 different tiers of how much we charge folks that are in different types of situations. So just making sure that we keep this program funded is a constant struggle. And we've had amazing support. I'll just say thanks to Maddie, because Maddie's fund has been an amazing support to us. PetSmart Charities, Purina, Hills, Zoetis, Decra, Boehringer Ingelheim. There's just IDEX. There's so many folks that have written, companies that have really put a lot of support behind us. But we have staff. We are funded pretty much all, except for that one position that the dean gave me, where the rest of it is soft money. So you have to keep searching all the time. So it's that balance. And then, of course, we're trying to run a veterinary clinic, and everybody knows the challenges with running a veterinary clinic. And then teaching students at the same time, and having a very, very intentional social work presence for our clients to make sure that they can have access to the resources they need, as well as providing foster and boarding, primarily foster for their animals when the people need their own inpatient care or safe housing that they can't bring their animals to.
Right. That's what's so attractive about your model, is that you really have such a comprehensive approach to addressing the challenges that homeless people are facing with their pets. So I'd love to dive more deeply into the different sources you provide. So let's go to Jennifer and talk about the social aspect arm, the social work aspect of the arm of WisCARES. It's so tempting to say Whiskers, just
it is. So many people say it.
It's memorable. So yeah, Jennifer, can you please elaborate more on what does that look like, the social work that you all provide to your community?
Well, social work at WisCARES, it's a few different things. When we work with clients, our goal is to have a social work touch to every client. Find out how they're doing that day. What do they need? Not everybody wants to have a social work touch, and that's fine. But if they do, what do you need? And we'll sit with them and find out they're in need of finding some food resources, or they were having trouble paying their electric bill. And then we don't provide a lot of direct services ourselves, but we refer them out to different places in the community. And the nice thing is, then the next time they come in, we can check back in and see, how are you doing now? Well, oh, that's good. So now you want to work on this? Okay. But each time we kind of see what is it that they happen to need. And, folks who are experiencing poverty or homelessness, there's a whole host of things that they experience. Social determinants of health, as we talk about that, they tend to have poor physical health, poor mental health, less social support, all kinds of things like that. And so what we want to be able to do is, while people are bringing their pets in to get them seen, we want to see what we can do to help them with those sorts of things as well. One of the things that we provide is a foster program. It's a free program, a temporary foster. So let's say someone loses their housing. They'll give us a call and see if we're able to care for their pet. And we have volunteer fosters who take in these pets. We can take them up to 90 days. And they're safe in a foster's home, being cared for, while these folks are able to work on housing and whatever else it is that they need to work on. And with the hiring of our second social worker, one thing that we're really excited about starting is trying to develop a model of case management, and kind of a brief case management model that will help us identify the most pressing issues that person has to deal with, and try and get that completed right away. Sometimes when folks get their animal into care, there's kind of a sigh of relief, and sometimes just kind of sitting in that relief, there's time that they could be getting stuff done and they don't, because they're just kind of, right, understandably. Sure. So we try to nudge a little bit and well, let me give you a ride to that appointment, or hey, did you happen to call that person? All those sorts of things. Try to help move things along. We, as you said earlier, or did we say that the reunification rate is 75%, and which is great. And for that last 25%, I'm just trying to work up a model of what's going on there. There are commonalities amongst those folks. And so we want to develop this model in a real intentional way to try and address what the common issues among that 25%.
That's huge. I love that. Can I ask a question too? If let's say if I came to you and I had a medical issue that I needed to be, my treatment would involve being in the hospital for a week. Is that another situation where I could receive the foster support?
Absolutely. Absolutely. We've had a number of people who need operations. Had a veteran who had a heart operation done. And so we work with the HUD-VASH folks at the Veterans Administration here. They contacted us about this fellow. And so we took his cat in while he had his operation, and then went home when he was ready. So
that's huge, because I can see so many people would put off taking care of themselves, needing the help they need, because they don't want to be separated from their pet. They don't want their pet to not have care. So can't get the medical treatment if I don't have that option.
They absolutely do. And there's a nobility, if you will, for these folks who they do put off their own care because they don't want to leave their pet out in the cold. They don't have someone. We talked about the lack of social support. They don't have someone who can take care of that pet. So it's either, okay, do I get my heart operation, or do I take my pet to the animal shelter? Right? They have to make really difficult choices. So we're trying to take away that they don't have to make that kind of a choice.
That's beautiful. All right. So that covers, I guess, in a nutshell, I'm sure there's a lot more to it, but some of the social work components of WisCARES. How about we talk now, maybe Kelly, you could talk to us about the educational component.
Yeah, absolutely. So WisCARES, as you can kind of get a sense, is a lot of moving pieces all the time, right? So we're doing the veterinary medicine and the social work. The other really big piece of what we do is teach our fourth year students, and we're starting to expand that into first through third year students as well. And it's probably one of the most I mean, everything about WisCARES is magical, but teaching the students is also magical every day. It's just seeing the students kind of pick up new skills and leave with like a lot of more confidence has been endlessly amazing. I never get sick of it. But what we do with the students is we take them on their 2-week fourth year rotations. And so we'll put them through orientation where they just see a few basic cases. Jennifer has a set of rounds that she'll do a couple mornings a week. So social determinants of poverty and what is social work, just to sort of gear up the students to what they might be encountering and how to talk about it. Then we'll talk about what accessible care is and what spectrum of care is. There are also communication rounds done on Friday and then again on Wednesday, so they get to do that 2 times. There's some reflective writing rounds. Again, that's all Jennifer. But then during the day, we're using that stuff. And so we have the students see cases and we really put them in a leadership position with their cases. And so we're going over everything with them and talking about them with them about how to talk to the clients and how to process the case. But then we're also really talking about how to tailor the work that they're doing to the person that's in front of them. So, how do we take an estimate to a person and talk about like, there's 6 things on this estimate. What if they can only afford 4 today? And how do we want to do that? And how do we want to have that conversation and move the case forward in a way that feels ethical and medically appropriate? But then it's also their only time to encounter real financial conversations, but it's in a really like supported, safe environment for them. And then on top of that, they're going back with their findings and telling owners about what they've found and how they're going to go forward with treatments. And it works really well. I think the students really like it. They do a really fantastic job. And I think for the most part, what we hear back from clients is that they're also very satisfied with the service, because I think the students are in a place where they're just working so hard every day to really get everything through to the clients. And, I feel, so I before I came to WisCARES, I was in a fast-paced, low-income setting where we were making low-income work by going very quickly. And so, I'd see 4 cases an hour, and people, I think, get this feeling when they're living in poverty of just being churned through these systems. And so our students can sit with people for an hour and talk through it and answer all their questions and really have a lot of valuable back and forth. And so that works well for our clients. It works well for our students. And we've done a lot of surveying of the students and have found that their confidence grows, their sense of being able to be a leader grows. They feel more comfortable around people that are less like them. And we see it anecdotally as well. And so, the students come in very nervous, and every 2 weeks they leave just like ready to be doctors. And it's a really great experience.
I wish that every veterinary student could have a rotation like this, because I can't tell you how many baby vets, I call them, that we often coach people who are in their first year of veterinary medicine, which is one of the most stressful years by far. And a common pain point are financial conversations with clients of all spectrums, and also depending on what kind of clinic they're in, how to provide a spectrum of care, right? Because we have like the best medicine in mind. This is the gold standard. We should aim for that. Is that really reasonable? And in a situation like this, you're really learning the spectrum of care and how it could apply in any situation. I also appreciate the depth of relationship that is built with their clients, because that is such a privilege to have. I'm thinking of like slow food. We have a slow food movement. I'm moving away from processed, just make a ton of soybeans and corn, to we actually grow things locally and cook them as a community and eat together and have time. And this is like slow medicine, where you get to actually have a relationship with the person and the pet and see them time and time again and chart progress. And that's why people go into medicine. That's what fills your cup, not seeing 4 patients an hour and grinding through and being like, I made, $300K this year, but my soul is dead. So I think it's a really beautiful model that I wish everybody could have a taste of, because once you've tasted it, it can help you understand it. Is that for you or not? And how might that inform your medicine moving forward and what you might gravitate towards in your career. But I love the confidence building too, like how it must feel to say, I came in scared and I came out the other side a lot more confident.
That is over and over. And I just wanted to add on top of what Kelly said is that we do survey the students. We are very intentional in how we work with them and teach them. And we turn those into publications. So we have a lot of academic type publications saying, this is how we do it, and this is why we do it, and this is what it results in. Wow. It's just trying to help change that model of how we teach students a little bit.
Can I ask a question? I don't know. This might be, I don't know if it's an intelligent question, but I'm going to go for it. Could there be something in the future where WisCARES offers like an internship to vet students or students have recently graduated, kind of like internship style, just wanting to hone certain skills? Is that a possibility or something you've ever thought of?
You want to answer, Kelly?
Yeah, it's something we're looking at right now. So we're currently looking for funding to support a position like that. So if any of you listening are interested,
donate. Make it happen.
Yeah. But it is something we're really interested in. And I don't think we were, there were a few years there where we weren't in the place to do that and feel like we were giving that a person in that position enough support, but we feel like we've grown now to be in that position and really help someone get their feet under them. And it's a growing field too, like there's more and more people who want to do clinics like this that are either academic based or for-profit or shelter medicine, community work. And so I always tell students, like, if you have the type of brain that likes to do 4 different things, see cases, write grants, teach things.
Exactly.
It might be the field for you if you want to come and solve these problems that we have.
I agree. I think it's extremely enticing. There's one of our team members at Full Circle, a social worker. She loves the shelter space. And so we're looking at building out a shelter arm to what we do, because it's kind of off the radar, right? We don't talk about it, but it's there. And this is every animal that I have is a shelter animal. Like I feel it every single day. And how do we support the people that are there day in and day out doing this kind of work? So I think that visibility is a huge part in just having people know that WisCARES exists and that you're looking to have this internship. And how cool would it be to be an intern that gets to experience that? Like, that would be awesome. It's okay. I'm going down a rabbit hole, but yeah, go ahead, Ruth Ann.
We do. So we do have students from other vet schools that will come and do rotations with us. And so that's a pretty common aspect of our daily or the clinic work that we do, is just having clinic students we had some from Colorado State. We have students from Iowa, sometimes from Minnesota. So where students have heard about us and want to come in and experience what it's like. The other thing I just want to say is that I completely want to acknowledge that what we do at WisCARES is, I think, what veterinarians do every single day of their lives, which is kind of, here's the context of this animal and this owner with this problem and all of these other pieces of what you have ability to do in your clinic and what the client has the ability to do, so that it's contextual, right? It depends on what's happening with this person and this animal at this time with, what's happening in your clinic. So I completely acknowledge that. It's not like we're teaching something brand new, but we're teaching it. Mm-hmm. Exactly. It wasn't really taught before, and people didn't really even, I feel like gold standard's a dirty word. I'm actually a medical oncologist by training, and I still practice medical oncology. But, not everybody, that's not for everybody to have that for their animal. Mm-hmm. And so it's all about context. It's all about kind of that what's right in this situation for this animal and this person.
I appreciate that it's so overtly taught, right? Because otherwise it's learned through experience and through osmosis. Like, I guess I'm learning this because I'm in a situation and I don't know what to do and I stumble through it. And then maybe I seek advisement from the medical director or my supervisor, but often it's learned through painful knocks. And it's nice that this is just part of the program, that it's a model that helps people learn to navigate it in a more intentional way. Wonderful. Well, we'll pause on that rabbit hole because we could do a whole episode on it. Let's pivot over to the clinical side of this and hear from Hillary. Tell us more.
Well, so it's pretty It's fun. It's fast paced. We do appointments on Tuesday, Wednesdays, and Fridays. Unlike most clinics, we don't book too far in advance. Just due to the fact that our clients have a lot going on in their lives. So we only book about 2 to 3 days. We do surgeries 1 day a week where we have 2 veterinarians. Dr. Schultz is not one of the veterinarians, but we have a doctor from the vet school come over, Dr. Berge, and she's amazing and she'll help teach along with Dr. Empey. So the students really, I love surgery, but it's so important to have the students involved in our surgery cases, just because as most veterinarians know, you don't get a ton of surgery while you're in vet school. So it is fun. I think surgery day is a big part for a lot of our students too. The other CVT, Heidi and I, we really try and let them put in catheters. We let them intubate. We let them kind of pre-med. They recover. They get to do a lot of things that in general practice or, maybe in an educational setting, they wouldn't get to do because they have technicians, they have assistants, they have other people to do that. So we kind of like them to see a little bit of everything. We do occasionally do dentals as well. So Dr. Empey will do that with the students and myself. We let them extract, we let them try and suture, just kind of get their hands a little dirty into everything, which is really fun. We see appointments from about 9 to 4 every day. And like Dr. Schultz said, they are an hour long. And we do like a wellness side and then like a sick side. So it would be like your ear infections, nothing, too major. We're not an emergency clinic. We do some urgent care things, but we can't really keep anyone overnight and things like that. But we also do same day appointments if we have the staffing, if someone calls in and they're like, something's going wrong with my dog. So we have a lot of flexibility, which is great. And hopefully we'll get to do a little bit more. But it's fun. It's really fun. So.
Thanks for painting the picture. Would you mind, for those listening today, let's imagine either someone may need this resource, like, hey, I'm low income, my pet, we're struggling, like I could definitely use something like this. Or I might want to refer people to you and I want to paint the picture before I refer it and I send them over and let them know what it's going to be like. Can you walk us through what a typical, orientation to your services?
Yeah. So the best part about so we talk a lot about a low income or people experiencing homelessness, but we're not a low income clinic. Essentially, we have a qualification process that it's a couple basic questions that our staff is trained on as far as our receptionist, Tina, who is amazing. She'll talk to you. And then we also have our student hourlies who are not just, they're pre-vet, they're first through third year vet students. So we always have students everywhere in the clinic. It's so much fun. So they qualify our clients to find out, if they qualify for the program, how they qualify, which tier do they go into. And so then we can kind of figure out where they're at. And so then we can see them for their appointment. It kind of helps guide the rest of the appointment is like if there's anything additional we need or what else we can help them with. It kind of also helps with social services because then we can be like, hey, Jennifer, there's a lot going on in this appointment, So, and then they can schedule an appointment. We see them, the students take the cases, they discharge them, they get to do everything. So a lot of our clients still do curbside, like post-COVID, because everyone, did that. A lot of people still prefer it. A lot of people want to come in. So it's kind of a toss-up as to what we get each day. But it's really fun.
And we're lucky again, because we have laboratory equipment in-house. We have a nice X-ray unit in-house. We have the ability to do ultrasound. So we can get a fair bit of basic diagnostics done. And we do work with the vet school. And so there are times when we'll send samples up to the vet school to get run by, if you have questions about something more specific. And 1 surgery suite, 3 exam rooms, kind of a social work room, and it's a good mix. We're located on a bus line and just off of kind of the highway that goes around Madison. So for access, we try and be more accessible. Kelly, you give a good overview of that, but I'm trying to think of the points that you bring up.
Also in like a vast vet ghost land, kind of.
Oh, yes.
A lot
Yeah.
around us.
Pure desert for sure.
Yeah. So, thank you, desert. I was like, ghostland is not the word that I wanted to use, but yeah, desert is better. But yeah, so there isn't a lot of vet clinics around us. We do have an emergency clinic up the road, but there isn't a lot at where we're located. So it is nice, but where we're located there's a specific reason as to why we're there, because a lot of the area, yes, and we're actually not too close to the vet school. We're also in like a low housing income area. So that helps, I think, a lot, and along with the bus line, like Ruth Ann said.
Really smart. Well, let's move into hearing some of your proudest moments or favorite memories from the time that you've been working together. Who should I put on the spot first? How about Kelly?
Yeah, I think one of my recent most sort of proud moments was when I started to realize that there's more and more talk at the school about us becoming a required rotation. Mm-hmm. And so that's not something that came from us. That has been coming from just sort of the gained respect and sort of teaching that we've been doing over the years. And so the school is pushing more and more for us to be required, and we're trying to figure out how to do that. But hopefully that'll come soon. So one of my favorite cases was, it didn't start with a dog. It's funny. It started with us getting a random donation of imidacide. And so we got this random box of heartworm injectables that was going to expire in a few months. And in Wisconsin, we don't see a lot of heartworm. We see it a couple times a year, but not that often. And so we got this box, and I was like, okay, well, this is great. I don't know if we'll use it, but the person it came from couldn't use it. And so I was worried it would go to waste, and I was going to start looking for somebody to take it. But then 2 days later, this sweet little dog who was just adopted from family members, so it wasn't through a foster organization. They just scooped it up from some family who couldn't take care of her anymore, tested positive for heartworm. And so she had come from the South. She had been a little bit she was a little rough around the edges and just so sweet. And the family was so sweet. And we were like, this belongs to you, clearly. And so it was meant to be. And we were able to get her treated and taken care of. And so she's negative now and living a cush little life. So
serendipity. That's a great story. Yeah. Oh, how about Jennifer?
Oh gosh. I think my favorite is we had a man bring his furry dog in, an intellectually disabled man. He came in with one of his caregivers. He'd been nervous to bring her in because he thought that we would report him to I was about to say social services, report him to animal control. Because the dog was matted and had the growing out curly hair. And it's like, okay, it's okay. We got this. And so Hillary, in fact, sedated him and started to shave him down.
Not the guy.
I was wondering.
And at some point, she realizes that the poor little dog's paw was off. And it was being held on by her. And someone can say it better medically than that. But so we were able to pull in a volunteer vet from the community who did the amputation. We were able to follow up with this man, make sure he was able to take care of the dog. He's brought the dog in again. And we've taken care of the dog, but I felt like it was just a great example of us going above and beyond for people someone who didn't have the resources to make this happen. And our clinic and volunteers in the community who believe in what we're doing, we all work together to make this situation work out for this fellow.
It's a beautiful story. It also reminds me of something we touch on quite often when we're working with team members is there can sometimes be a narrative. I'm thinking about emergency, which is where I cut my teeth as a technician, where let's say someone comes in and diagnose the pet and say, the treatment to salvage the pet's life would be $1,200. They won't be able to afford that care, and they're going to elect to euthanize. And then the talk in the back in treatment becomes, why do these people have animals? They can't afford them. What the F? And it's like, it's a downward, very fast negative spiral. So we talk about that a lot in the work we do with clinics is how to come in with compassion and how to work with that client to the best we can. And I think that your example is a great example, because that moment when you see a matted animal and you see its paw or arm in the condition that it's in, people might gasp and say, oh my gosh, how could this person own an animal? This is ridiculous. We should definitely call, and report this and have the animal taken away and give it to somebody who can afford it and can take care of it. It's a, you know what I mean? Like the line can get crossed so fast and we go down that path. So it's beautiful to see an example of how you're able to work with somebody and build a relationship with him. And now he's bringing the animal back. You're checking in. He's no longer fearful that his pet will be taken, and you're able to really bridge that gap. Nice. Love that one. How about Ruth Ann, do you want to follow that one?
So, well, I'm just going to say I'm so proud that WisCARES is in its 11th year. Just that we've been plugging away this long and scrappy and going to keep on doing it. And we are just getting more and more legit as time goes by. I guess I have two things that I will say. One is in the very, very early days of WisCARES, when I was doing more of the clinical work and more of the hands-on, we had a woman who was experiencing homelessness, and I had seen her at the Tenant Resource Center. She had walked in with her dog and had an ear infection. She was always worried that her dog had urinary tract infections. She was doing okay, but then we actually found an anal sac tumor on the dog, and sometimes these tumors can do so well with surgery, or they can be very, very slowly progressive, and the animal can do well for a long time. We actually were able to get funding for her to have the mass removed. And when it came to have the dog go back with her, I made the mistake of saying it was time for her to go home. And the woman said, well, I don't have a home and I can't take her back. And she loved this dog so much. And she had talked about, how this dog was her safety, was her companion, was her, sort of way to be part of society. And she ultimately did come and take the dog back with her. And it was just a really important lesson in language of she's ready to be back with you again. She wants to be with you. She misses you. And just not even thinking when I said, it's time for her to go home. Well, yeah. I don't have a home.
Oh, so simple and so tender.
Yeah.
Yeah. It's a great example. Thank you for sharing that one, Ruth Ann. Hillary, do you have one?
I have lots.
You could do more than one. We have time for two.
I have one that we have it's similar to the story Jennifer kind of told. It was also a little white dog. The owners had just lost their job and became homeless. But they were probably some of the kindest people I've ever met. They've been through more than I could never imagine. And they were still unbelievably kind and sweet. And I ended up shaving this pet down a little bit and realized that it was very similar to Baby Boy, and the matting was quite bad. And so we thought we were going to have to amputate a limb again. And so the vet that came in to help with the other patient came in again. And as we were prepping that next day, I had sedated the dog and was kind of cleaning it up and and I was like, this doesn't look, I'm like, there's a lot of blood flow here. And so then we kind of talked, and with the owners okay, we were able to find someone to take her for the next couple weeks, and we just kept cleaning it up, and she has full use of that limb. And it's great. They still come and visit us, and they bring her in and we see her, and she is just the sweetest dog you could ever meet. She's so cute and just lovable. And the students love her. Everyone's like, if they see her, they all know who she is. So it's really great to see her. So that's great. And the owners are just, they're amazing. And it kind of rebuilds your faith in humanity and people. And, you know, you can have the worst things going on and still give kindness and receive kindness from people. So that's like my people story one. But then I have one in his, and it was actually Dr. Schultz's friend kind of from the Milwaukee area. We saw this patient come over, and this dog is just giant dog, a huge, had a grill with a charcoal grill. I was trying to think of the words. A charcoal grill fell on top of the dog as they were barbecuing. It was a couple summers ago, and just so much burns. And this dog let me do almost anything to it without sedation and still was licking my face. And just with working with another vet clinic in the Milwaukee area who was able to help, we saw him like 2 weeks later, and his wounds were healing, and just, you know, like networking, and just, it was really great just to see like what we do, and then to have another vet clinic want to do the same thing, like really is just awesome. So it was great.
We want some big dog energy, you know?
Yes, I love big dogs.
What beautiful stories. Today I asked you all each to put you on the spot. We didn't plan for this one, but what would you say is one of the primary feelings you feel at the end of the day after doing having these experiences? What do you walk out of the clinic feeling?
Well, I'll say I actually, and I know this probably sounds corny, but I actually say WisCARES saved my veterinary career. I came to WisCARES not wanting to be probably in veterinary medicine anymore. I'd been in it for a while, and as a CVT, I was getting burnt out. I was tired, and I had just had my daughter, who was about 6 months old at the time, and I was making a career change. So I kind of looked at my family and was like, well, if it works, it works. If it doesn't, it doesn't. I can stay home. And I could not imagine not going to work. I had a 2-minute commute. Now I have a 30-minute commute, and I don't care about my drive. I love our crew. We have the best team imaginable. Like, I could never imagine working with anyone else. And I love the students. So I'm so thankful to have the students. They're such a breath of fresh air. They make you want to love veterinary medicine again. They get their first blood draw. They give their first vaccine. They draw up their first vaccine. Like, there's times where they're like, I've never drawn up a vaccine. And you're like, whoa, like in Europe, so it's just so refreshing that the littlest things to them that you have done a million times, it means nothing. It's such a big deal to them. And they're so grateful, and they're so appreciative, and they're so kind. And then to get to do the work that we do with the people that we meet, and the stories that we hear, and the pets that we see. I mean, don't get me wrong, every day everyone has a bad day. It's veterinary medicine and life in general, but I truly love coming to work every day. Like, I love it. It's so much fun, and it saved my life in vet med. So I'm super grateful for WisCARES. So
Beautiful. Beautiful. Kelly.
Yeah, I think what I feel is a sense of purpose is one of the things, like I know a lot of people who go to work and they don't know, like, why am I doing this? What's my purpose? It's like a big, question to ask in your 30s and 40s, I think. But I feel like WisCARES is such a strong purpose, and every day, either students are learning, people are being helped, animals are being helped, we're getting the word out, giving talks, doing all kinds of stuff that just matters, like it just, there's a lot of purpose to the work that we do. Yeah.
Purpose really matters.
Yeah. And so every day feels fulfilling in that sense. And to Hillary's point, I was in private practice before, and I could not fathom doing another ear cytology at one point. I was like, I can't do this. And then when I got into teaching, the students were like carefully preparing their slides, carefully looking, spending 10 minutes at the, looking and counting the yeast and the bacteria, and then would come to us with their findings. And it was just, wow, this is new to them. Or, they'll feel their first luxating patella and just like, So all that stuff that just becomes run of the mill after a while is new and fresh every day.
Yeah, it's almost like having kids where you just see it with beginner's eyes all over again. What a joy to have that experience. Jennifer, how about you? How do you feel at the end of the day?
I think with a sense of gratitude that I get to work in this amazing place, right? And that we really work to make it a pleasant workplace, a positive workplace, modeling that for students, and being able to work with the clients that we work with and walking alongside them during just these really difficult times in their life. It's a privilege. And I feel really, it's a sense of purpose. And I feel I'm grateful that I get to have this experience.
Yes, I love that. And Ruth Ann?
Well, Crystal, when we talked about communication and in our other podcasts and having faith in humanity and knowing that people are human and there's a story behind everything, I think now, especially with kind of a national climate of suspicion and anger and lots of negative emotions, being able to have help students learn and then always be practicing ourselves within the staff of how do we look at one another with kindness, with fallibility, with kind of owning what we do and then trying to make the world a better place in the way that we can. And that's what I'm really, really grateful that I had the opportunity to make it happen, and then just to have a group of people that have come together to make it even more than what we could have ever imagined, really.
It's just beautiful. I'll say one of my ulterior motives for having you all on this podcast is that the origin story for Full Circle Lab and for the podcast as well was my own story, kind of like Hillary, where I left veterinary medicine. I was one of those people that started at the top of the circle with the love of this industry, of medicine, of animals, of people. And then through a series of events came to the bottom where I left the industry. And some people leave the industry, some people leave life. And both those options, I think, are really terrible options. And to find meaning and purpose again, that brings us back to the top of that circle is why I love highlighting what you all are doing. Because I want people who come to this podcast who might be feeling like they're sliding to the bottom, who are thinking, I don't know if this is a profession for me. I'm over it. I'm tired. I'm exhausted. I'm beaten down. My heart is broken. My brain is tired. That feeling you get to know that there are other ways that you can be in the vet med profession and that there are very creative models out there and there are things that can speak to your heart. You can march to the beat of a different drum. So I love that you created this. You saw a need. You started with basically nothing. And here you are 11 years later with your cups very, very full and so many lives touched. It's impressive. I hope that people that are listening take inspiration from that to do something different. To be involved and to help out. Like, you can make a difference. For those who are listening today that may want to learn more about you or connect with you, what's the best way for them to do that?
Probably the best way to get in contact with us is through our website, which is www.wiscares.edu. And our email address is on there. If you want to support our program, there's a donate button. So happy to hear from you. Would love to be in contact and support, questions, suggestions. We'd love to hear from you.
Perfect. And I'll just say, I found this very easily. I just typed in WIS, W-I-S, like Wisconsin, and CARES, C-A-R-E-S. And it was the first thing that popped up on Google. So your SEO is on point. So also, I'm going to put all this in the show notes so you don't have to look for it. It'll be there. Just click on the podcast and all the links will be there for you all.
I do want to add, because Hillary does such a fantastic job with her social media, yet you can also find us on social media.
Ooh, you love to see your cute pictures.
Yeah, Facebook and Instagram. So follow us. We do have a clinic cat, and his name is Yoki, and he's usually the center of our posting. So follow for him. Our students like to dress him up quite frequently. So
you know how to bait us in. Like, that's totally work. Awesome. Well, thank each of you for being here today. It's been such a blast.
Thank you, Crystal.
Thanks.
Thank you.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.